you feeling stuck in a cycle of relying on medications to manage your diabetes? Do you find yourself anxiously waiting for that next doctor's appointment, hoping for answers, but actually leaving with more questions? Maybe you feel like you've lost control over your own health, that your condition is managing you rather than the other way around. You're not alone, actually. So many people I've worked with have shared these same feelings: frustrations, fear, and even hopelessness. It's exhausting to feel like your health is out of your hands, like you're at the mercy of prescriptions and appointments with no clear path forward. I am a doctor. I work as a GP in West Wales, but I've had the privilege of running diabetes remission clinics for years and continue to do so across the UK online. And I see this situation from both ends. I see the strain and pressure to provide healthcare and the lack of time that I have for education. And I also see the frustration of patients struggling to get through on the phone, only having 10-minute appointments and getting lost in the system. What I don't have the time to say is exactly what I aim to provide in this and the many other videos that I've made on this topic. Because here's the truth, it does not have to be this way. There are different ways, a way to take back control, to work with your body rather than against it, and to start seeing real changes in your health. Because with the right strategies, you can reduce your reliance on medication, the need to see doctors. You can stabilise your blood sugars naturally, and I want you to feel empowered to make decisions that support your long-term health. Because the best part, you don't have to wait for somebody else to hand you the solution. The power to transform your health does start with you. So in this video, I'm going to share the natural strategies that I've seen work time and time again for the people that I've helped. We'll talk about the lifestyle changes that can make the biggest difference, the role that sleep, stress, hydration have, and when medication might still be necessary as part of that bigger picture. By the end, you'll have a clear understanding of how to take the first steps toward managing your diabetes in a way that feels empowering, effective, and sustainable. I want you sticking with these changes for the long term. So let's start with the foundations of type 2 diabetes management: lifestyle change. These are the changes that can help you reduce your reliance on medication, improve your blood sugar control, and support other health conditions at the same time. Number 1 is your diet. The food you eat has a direct impact on your blood sugar levels. A low-carb diet can help stabilise your blood sugar and reduce the highs and lows that often require medication to manage. So focusing on non-starchy vegetables, healthy fats like avocado, olive oil, and high-quality protein sources. And don't forget about fibre. It slows down the absorption of sugar and helps keep you full and satisfied. The second is exercise. Now, movement is one of the most powerful tools you have for managing diabetes. Even a 10-minute walk after a meal can help your body lower that blood sugar level. The key is to find activities that you enjoy, whether it's walking, swimming, yoga. Strength training is really good, and try to make them a regular part of your routine. The third is stress management. Stress can and does wreak havoc on your blood sugar levels. When you're stressed, your body releases hormones like cortisol, which can cause your blood sugar to spike. So incorporating stress-reducing practices like deep breathing, mindfulness, or even just taking time for a hobby, it can make a huge difference. The fourth is sleep and hydration. These are often overlooked, but they're so critical for blood sugar control. Poor sleep can increase insulin resistance, while dehydration can make it harder for your body to use that insulin effectively. So aim for 7 to 8 hours sleep each night. Drink plenty of water throughout the day, and it'll set you up better. And these changes, very brief, they don't just help you with blood sugar, they also improve your energy, your mood, overall quality of life. And the best part is that many of these changes can start showing results within days or weeks. When it comes to managing type 2 diabetes, there's one truth that becomes clearer with every study, which is lifestyle changes are the most effective treatment. In fact, when you compare lifestyle interventions to medications, the results speak to themselves. Lifestyle changes consistently outperform tablets, particularly when your goal is remission. This means that if you're aiming to reverse your diabetes, focusing on what you eat, how you move, and how you care for your body is far more powerful than relying solely on prescriptions. Scientific studies have shown us 3 proven ways to reverse type 2 diabetes. These are: number 1, very low calorie diets. Research has shown that very low calorie diets, often involving meal replacements, can rapidly reduce fat in and around the liver and the pancreas. This helps restore normal insulin function and can lead to remission in some individuals. But these diets are really restrictive, and they're best done under medical supervision. The second is bariatric surgery. So gastric bypass, for example, has been shown to induce remission of a significant number of people with type 2 diabetes. It works by altering the digestive system, reducing calorie absorption, and it does improve insulin sensitivity. And it is effective, but it's a major procedure that has risks and really is not suitable for everybody. And the third way is the low-carb diet. This is one of the most sustainable and accessible way to reverse diabetes, and my personal favourite. By reducing carbohydrate intake, you lower the amount of sugar or glucose entering your bloodstream, helping you to stabilise those levels and improve your insulin sensitivity. This approach doesn't just help with remission, it promotes long-term health and is something you can adapt to your lifestyle. What's interesting is that tablets don't feature on this list. Medications are not a tool for reversing diabetes, they're a tool for managing it. And while lifestyle changes can outperform medications in trials, this absolutely doesn't mean you can simply stop taking your tablets. And I want to talk about why. Medications play an important role in managing blood sugar levels, especially in the early stages of your journey. If your blood sugar levels are very high, medications can help stabilise them quickly and prevent complications. They act as a safety net while you begin to implement lifestyle changes. Think of them as a support system. They're there to help you manage the immediate risks while you work on the root causes of diabetes through diet, movement, and the other changes that I've mentioned. There are some medication, like metformin, that can help reduce insulin resistance, while others may help your body produce more insulin or lower the amount of sugar your liver releases. These medications are invaluable in preventing dangerous complications like nerve damage, kidney problems, or retinopathy. And this is why it's so important to work closely with your healthcare provider as you make these changes. Do not stop medication suddenly just because you're aiming to reverse your diabetes. If your blood sugar levels start to improve, your medication doses absolutely need to be adjusted, well, especially to avoid issues like low blood sugar, hypoglycemia. And stopping or reducing medications without professional guidance can be dangerous, so always consult your doctor before making any changes. The key takeaway here is that type 2 diabetes is best treated with lifestyle changes. They not only address the root cause, but they also offer the best chance of remission. Medications still have an important role to play, especially in the early stages or for those with more severe cases. It's not an either-or situation. It's about finding the right balance for your unique circumstances. And that's what I do in the Blood Sugar Mastery Programme. We guide you through this process step by step, helping you implement lifestyle changes while working alongside healthcare providers to ensure that the treatment plan is safe and it's effective. Because when you combine the power of lifestyle with the right medical support, that's really when true transformation happens. Now, if you want to really understand the changes needed and to get a good understanding of the root cause of diabetes in your body, then head over to my free video series to learn more.